Hi, Soha. Thanks for taking the time to talk with me today. Could you start by telling us a little bit about yourself?
Yes, sure. So my name is Soha. I am 35. I'm a mom of two. My first one, he is 3.5. And my second child, he's almost turning 1 in a couple of days, actually. And I'm a family physician, and I'm actually going to start providing OB care as well very soon. So I pretty much take care of everybody, kids, adults, and now pregnant mamas to be.
That's great. Thank you. All right. Where do you now see a gap in your care that you receive during and after pregnancy, or your knowledge that we could use to help educate other moms on how to advocate for themselves in that situation?
Okay, so I had C-sections for both of my kids, and I think it's really important for C-section moms to know that this is a major operation. And so the care after a C-section is a little bit different from vaginal delivery. So you have to really know if you're having fevers or not. And initially, I wasn't truly having fevers because I was masking it with Tylenol since I was taking that for pain. And I think that's something to keep in mind. But I was getting headaches and just not feeling like myself, especially when the Tylenol was wearing off. And I think that was a sign from my body that something was going on, and had I not been taking that medicine, I would have been having fevers. And if you get a fever when you are post-operative, then you should really get it checked out. So I think that was one thing that was definitely a gap in care and a little bit of knowledge as well, because I wasn't really anticipating a fever, so I kept taking the Tylenol for the pain, but eventually ended up masking a fever, which again, when you're post-operative, is a really big sign that something isn't right. So I think that just knowing, to treat yourself as a post-operative patient when you've had a C-section is really important for moms to know, because a lot of times, moms will tell me when I ask about surgical history for new patients, they won't even mention their C-sections as surgeries. And it is a major abdominal surgery, and it's the only one where you're expected to take care of another person right after you have that surgery. So I think that's one, gap in knowledge, and then that leads to a gap in care because you aren't really paying attention to your vital signs as a post-operative patient, and you're just trying to take care of a baby. So
That's great. Thank you so much.
yeah.
Yeah, I'm sure it is super hard to be as aware of what's happening with your body when you're sleep deprived and everything already hurts and
Yes.
it's hard to decide what is a
Exactly.
symptom just of your delivery experience and what's unusual. So
Yeah.
I think that's super common.
Yeah,
Oh, great.
for sure.
Thank you.